Hi everybody, this is Elise Cody, and I am going to be presenting this week on the ANA's position around advocacy for the rights of LGBTQ plus patients. So I guess I'll just start with what LGBTQ plus means for those that may not be familiar. So LGBTQ plus means lesbian, gay, bisexual, transgender, queer, and questioning. And basically, this is just terminology that encompasses the spectrum of identity around gender and sexuality. So the essential argument that the ANA is making here is that different populations of people have different health care needs, and that nurses need to be sensitive to these needs. So research shows that there are major health disparities that exist for the LGBTQ plus population, and that this population have higher rates of morbidity and mortality. And I'll kind of get more deeply into the evidence around that in the next few minutes. So we've encountered in our classes the ANA Code of Ethics. So the ANA says that we have an ethical responsibility to our patients. So first of all, the ethical code states that nurses have to provide high quality care to our patients regardless of individual differences, and that even includes putting our personal prejudices aside, so that we can provide quality care for everyone, and that right to care is universal. So the ANA says that nurses must also deliver what's called culturally congruent care. In my personal interpretation of that is that we have to see our patients as whole people, not just a body with a disease process, but our patients are made up of spiritual and emotional aspects as well, and that our patients' identity and lived experiences and worldviews impact their disease processes, and we have to adapt to these needs if we, as nurses, really expect to provide therapeutic care for our patients. So the last thing that the ANA says ethically is that we as nurses have a responsibility to try and reduce health disparities that exist. And we have to advocate for justice in healthcare, in resource allocation, and in access to care. So unfortunately, the state of things at present is that the LGBTQ population experiences significant health disparities, and they do not have equal access to care. So with that, let's get into the evidence and into the facts. So currently, LGBTQ plus people, according to research, make up about 4% of the population, or 10 million adults. And additionally, on top of that, research indicates that there's another 1.7 million high school aged youth that also identify as LGBTQ plus. So LGBTQ plus youth are 2 to 3 times more likely to attempt suicide. They're also more likely to be homeless. They're at higher risk for STDs, and they're also more likely to be bullied. For adults, men that have sex with men have a higher risk of contracting HIV and AIDS, especially among people of color. LGBTQ plus folks are more likely to smoke. They have a higher rates of substance abuse, as well as depression and anxiety. Some other struggles that this population faces, according to research, are social stigma, and really just a lack of providers that know how to properly care for them. So as a result, LGBTQ plus folks don't seek care for fear of experiencing prejudice, or that they just won't receive appropriate or effective treatment. So the natural question is, what can we as nurses do? And the ANA issues quite a few recommendations for nurses who want to advocate for our LGBTQ plus patients, and I'm just going to share a few with you that resonated with me and excited me. So one big issue in healthcare for LGBTQ plus folks has been patient surrogacy and visitation rights. So the ANA firmly holds the position that nurses need to advocate for the rights of patients to choose their healthcare surrogates. So basically, it's not just blood family; they're able to act as their surrogates, and that patients are able to also choose who has the rights to visit them in the hospital visitation privileges. Um, at our hospitals and clinics, we should also advocate. This is a big thing that we can do, that in our assessments and in our patient demographic data, we have a way to collect data about sex and gender identity. What this would do is it would allow nurses to know when it's appropriate to provide this culturally congruent care for LGBTQ plus folks, so that we can use appropriate pronouns. Obviously, this information would remain private and is only shared on an as-needed basis for the purpose of providing better care. Another thing that they suggested is in our nursing schools that we advocate for the inclusion of LGBTQ plus specific issues in our curriculum, particularly gender-neutral terminology and documentation. Lastly, this is the really big one. We need to advocate for behavioral health services in our communities. I know this is a big issue for us in rural Wyoming, and we need these behavioral health services to include LGBTQ plus specific issues. The other thing I want to mention is we need to look out for our colleagues. We need to stand up when we see discrimination and incivility and bullying in our workplace, and look out for our LGBTQ plus coworkers and nurses. Okay. At the end of this presentation, I would like everyone just to come away with a good reminder that every patient we see has unique needs that impact their disease process that are based in their identity and their culture, and we as nurses need to assess for them and address them. The other big thing is we need to really look out for our LGBTQ plus patients right now. As we all know, 2020 has been a year where many people have had mental health difficulties and crisis, and we need to remember that LGBTQ plus population is particularly vulnerable to mental health issues. So we really need to be hyper vigilant and assess our LGBTQ plus patients really well right now. Lastly, one thing that I learned is that the ANA has a really long history of advocating for LGBTQ plus population. The first ANA position statement on LGBTQ plus issues was issued in 1978. So as we go forward, we can be really proud to be a part of a long legacy of nurses that fight for social justice. Thank you.